Welcome to the Explainer. Today, we're mapping out one of the absolute most vital, high-stakes intersections in the entire human body, the carotid triangle. If you've ever wondered exactly how your brain and body communicate so seamlessly through that narrow little corridor of your neck, well, you are definitely in the right place. We're going to explore a space that is so incredibly densely packed with critical arteries, veins, and nerves that even the slightest disruption can have immediate and honestly pretty dramatic consequences.
Okay, so let's dive right into this with a totally fascinating clinical mystery, and it starts with a seemingly harmless piece of everyday clothing. Imagine you're getting dressed for work. You pull your collar together, you tie your tie maybe just a little too tight, and suddenly, boom, everything goes black. Seriously, can a tight tie actually make you faint?
Well, our source text presents a textbook case of exactly this phenomenon. We have a 35-year-old man who complained to his doctor that he suffers from sudden fainting attacks, or syncope, simply by turning his head. And this happens especially when he's wearing a tightly knotted tie or a stiff collar. It sounds like some bizarre magic trick, right? But the true culprit lies hidden within a very specific geometric space in his neck, which is our focus today, the carotid triangle.
To solve this mystery, here is our quick roadmap. 1. The vital neck intersection. 2. Boundaries of the triangle. 3. The carotid arteries. 4. Nerves in the carotid sheath. And 5. Clinical correlations and syndromes. Let's get into it.
Section 1. The vital neck intersection. Let's find out exactly where this critical zone is located. So the neck is divided into larger, more manageable zones. Conventionally, you've got this prominent muscle called the sternocleidomastoid that transects the side of your neck obliquely. It effectively divides the neck into anterior and posterior triangles. Now, the anterior triangle, which is bounded by the midline of your neck and the jawline, is actually quite large. So to help us locate specific structures, this large anterior triangle is further subdivided into the submental, digastric, muscular, and, of course, our main focus for today, the carotid triangle.
Moving right along to Section 2, Boundaries of the Triangle. Time to map the borders.
I want you to visualize this space as a highly distinct bordered territory. It's kind of like a tightly packed little anatomical room. A super fascinating detail from our source is that the major contents of this carotid triangle are actually overlapped by the sternocleidomastoid muscle, meaning to get a really good view of the structures inside, you physically have to pull that muscle backward. By mapping these muscular boundaries, we can frame the exact walls and floor of this room. The ceiling, superiorly, is the posterior belly of the digastric muscle, supplemented by the stylohyoid. The front wall, antero-inferiorly, is the superior belly of the omohyoid. The back wall, posteriorly, is the anterior border of the sternocleidomastoid. And the floor holding this whole operation up is paved by the hyoglossus and pharyngeal constrictors. All of this is enclosed by a roof of deep cervical fascia. So yeah, it's a highly specialized, totally enclosed pocket.
Okay, Section 3, the carotid arteries. Let's look at the VIP blood vessels inside this space.
Think of this triangle as an exclusive VIP lounge housing the body's main supply lines to the head. The massive common carotid artery ascends right into this space and splits into two, giving us the internal and external carotid arteries. And here's a golden fact straight from the source text. This triangle is where your carotid pulse is most palpable. You can feel it right at the superior border of your thyroid cartilage. Interestingly enough, in emergencies, this artery can actually be compressed against a specific spinal bone, Chassignac's tubercle, to stop severe bleeding. Pretty wild, right?
Notice the sharp division of labor here. The internal carotid artery is basically an express train. It gives off 0 branches in the neck and shoots straight up to supply the brain. But the external carotid, it stays super busy locally. As it ascends, it acts like a major distribution hub, firing off 5 crucial branches right inside the carotid triangle: the ascending pharyngeal, the superior thyroid, the lingual, the facial, and the occipital arteries.
Section 4. Nerves and the carotid sheath, the high-priority conduits.
Let's talk about the heavy-duty protective casing wrapping all these structures up. The carotid sheath acts as an ultra-secure conduit extending all the way from the base of the skull straight down to the arch of your aorta. And inside this sheath, oh, it is packed tightly. You've got your main neck vein, the internal jugular, your carotid arteries, and the massive, all-important vagus nerve safely tucked right between them on a deeper plane. It's essentially a biological superhighway cordoned off from the rest of the neck. And surrounding the superhighway is an intense concentration of wiring. I mean, it is incredibly crowded in here. The vagus nerve runs straight down the middle.
The spinal accessory nerve crosses the top. The hypoglossal nerve notably hooks right around that occipital artery we mentioned earlier. You even have a U-shaped loop called the Ansa Cervicalis embedded directly into the sheath's anterior wall, plus the sympathetic chain lying securely just behind it. It really is a masterpiece of compact, high-stakes biology.
Finally, Section 5, Clinical Correlations and Syndromes. Let's see some real-life applications.
Now, to understand our opening fainting mystery, we have to contrast two highly specialized, easily confused structures located right at the carotid bifurcation. On one side, we have the carotid body. That's a small oval structure acting as a chemoreceptor. It's monitoring blood gases like oxygen and CO2. But on the other side, we have the carotid sinus. This is a slight swelling at the origin of the internal carotid artery. The sinus acts as a baroreceptor, meaning it is literally the body's most important pressure sensor, constantly regulating your blood pressure.
And this is exactly where it gets critical for our case. The source text reveals what happens when this pressure-sensing carotid sinus becomes overly sensitive to outside physical touch. It points out that in someone with carotid sinus hypersensitivity, simple pressure on those sinuses can cause a massive slowing of the heart rate, a plunge in blood pressure, and cerebral ischemia, which is a lack of blood to the brain, ultimately leading to fainting. It's just an extreme, cascading physiological reaction to a simple physical pressure.
And there is the answer to our mystery. This condition is known as carotid sinus syndrome. So, our 35-year-old patient wasn't suffering from some mysterious neurological disease. No, his tightly knotted tie was physically pressing directly on the hypersensitive baroreceptors located right inside his carotid triangle. Every single time he turned his head, that stiff collar squeezed the carotid sinus, tricking his brain into thinking his blood pressure was dangerously high. His body's automatic response was to slam the brakes, drastically lowering his heart rate and blood pressure, depriving his brain of oxygen, and causing him to literally pass out on the spot.
I love this case because it brilliantly illustrates just how delicate, interconnected, and densely packed our anatomy truly is. The carotid triangle isn't just some boring textbook diagram. It is a bustling, high-stakes intersection where literally a millimeter of difference can knock you off your feet. It definitely leaves us to wonder, if a simple, everyday piece of fabric can inadvertently hack your cardiovascular system, what other hidden vulnerabilities and physiological marvels are operating just beneath the surface of our skin right now? Definitely something to think about the next time you reach for a tie. Thanks for exploring this with me today.